Delighted to say we've been joined by a regular contributor to the Healthy blog. It's Simon. Good morning, Simon. How are you, sir?
Sponsored by Beecham's today, so I'm a little bit full of cold, but okay.
Well, it's a particularly heroic effort then that you've still managed to come and join us. We're very grateful for that. We last spoke to you in May, and we were talking about lay members and other things.
Yes.
So tell us a little bit about what's been happening at Holton CCG since we last had a catch-up in May.
Well, you join us in a really crucial week, actually, for us. We have to submit our authorisation application by a week today, which is the 1st of October.
Right.
So actually what we're aiming to do is have everything uploaded and onto the authorisation site for Wednesday.
Right. What's an authorisation application site?
Every clinical commissioning group has to go through, it's like a driving test, basically. We have to show the examiner, which in this case is the National Commissioning Board, that we're competent and fit to undertake the statutory duties that are coming our way from the 1st of April.
Wow. This
involves uploading evidence against 6 domains and 119 keen lines of inquiry.
Gosh.
Again, so it's effectively like answering an exam question, but there's 119 exam questions.
Wow.
So that's the job for this week. Want to have that boxed off by Wednesday evening, because we don't want to be scrabbling around doing that Monday morning of next week.
No. Well, I'm doubly grateful then that you've still found the time to meet with us today.
That's fine.
How's it going? Are you confident about the process?
I think we will be authorised. There will be some conditions attached to that. We will have a development plan. I think we're very aware of where our development needs are. We're still a young organisation.
Yeah.
We're only 10 months old or so.
Yeah.
But I also think there's a great story to tell. There's a great story to tell around, as you said earlier, the recruitment of 4 lay members.
Yeah.
The national guidance suggests 2. The 4 lay members have got Bob Bryant, who many of people watching this blog will know.
Absolutely.
One of the most enthusiastic interviews I've ever been in terms of somebody championing the cause of local people and patients locally.
Yeah. Absolutely.
David Austin, who's an ex-borough councillor.
Right, yeah.
Very active in local community groups.
Excellent.
We have Ingrid Fife, who's chair of Holton Housing Trust, background in nursing, also in the commercial sector, and again very, very aware of the needs of people of Holton.
Yeah.
And then David Merrill, who used to be on the Holton St Helens board, and brings a wealth of experience around governance and audit.
Terrific.
And will be our deputy chair.
Wonderful.
So there's a story to tell around that.
Yeah.
And also around our integration with the local authority.
I'm delighted you've got 4 lay members, and as you said that the national guidance said only 2 was necessary. What made you think, now we're going to go with 4?
We wanted to make sure there's a good, strong voice of local people in everything we do.
Brilliant.
Being on the governing body gives a representative voice rather than obviously a direct voice.
Yeah.
But a voice nonetheless, and a good skills mix across all our committees and all the work we need to do.
Yeah.
The other way we want to engage local people is actually directly in the work we do.
Okay.
In terms of service redesign, commissioning and so on. We want to establish the Holton People's Health Forum, which effectively the 3rd meeting, because we had 2 events already this year. We'll be launching properly in November. But also, as GPs are the closest, amongst the closest practitioners, clinical practitioners to patients, obviously there's a lot of stories and experience to be told through that interaction as well.
Fantastic. And what would you say the GP on the street then, which isn't the correct term, but how are GPs taking to these changes?
Well, I think they're embracing the changes. Obviously, they're wanting to take a good, strong role in clinical commissioning, and already have done. We've already got an active set of GPs involved with mental health, learning disabilities, children's services. We've got 8 practices signed up to the wellbeing practice approach, which is about you go to your GP to get well, you use your practice to stay well. There is a challenge obviously around time and resources, and they still have their clinical jobs to do. But we're putting in measures through which that will be. We'll make sure that happens.
Terrific. Now, you mentioned earlier on the Holton People's Health Forum.
Yes.
We've been reading a little bit about that on the CCG website. For people hearing about that for the first time, tell us a bit about that, and also how you think voluntary sector groups could contribute.
Well, it's in the similar fashion to the events we ran in February and May jointly with the Borough Council. The idea is that our engagement and involvement knits itself in with that of the local authority. So we're making contact with people at different times over different messages, or at the same time together. Yeah. The People's Health Forum fits in terms of it will be held on the 2nd of November. We're looking for a venue at the moment. It's likely to be the Stobart Stadium. Okay. It'll bring in the patient groups from each of our 17 practices. There'll be an open invitation to the voluntary sector and to anybody else who wishes to come along. And rather than it's another opportunity, or to build on what we did in February and May, to actually set what we're going to be doing, what's our key priorities, and how we're going to deliver them through 12-13 and beyond. Wonderful. So this isn't just an information sharing exercise. You really do want to hear what people have to say about what the priorities should be. There's an element of information sharing, there's an element of us actually receiving information. Yeah. There's also an element, I think, and there's going to have to be about the voluntary sector and the wider public getting together to discuss issues that are of interest to them, that concern them. And they won't necessarily be specifically health issues. Right. The biggest challenge to health and well-being in the borough over the coming years is the welfare reforms. Right. And we would want to work alongside the Borough Council and our partners from Holton Strategic Partnership Board to actually start getting some messages out to local people about the welfare reforms. It's going to affect 1 in 3 people in Holton directly. Wow. It will affect everybody in Holton indirectly. Yeah. Whether it be through council tax reform, the reform of DLA, disability living allowance, to become personal independence payments, is likely to increase pressure upon our GPs through increased appointments within general practice, notwithstanding the economic impact of this. Definitely. And I suppose it's key for voluntary sector groups to understand these changes as well, because these will impact on their service users, of course. Yes. But also, I think in the world of funding, how voluntary sector groups are funded, it's key for them to get a good handle on that. So that's on the 2nd of November, is that right? 2nd of November, yes. And then that will be followed by actually an event with our member practices on the 29th. Okay. So that will draw upon what we've heard from the public, what they've said, match it against what we need. Match that against what we know we have to do. And then from that will come our commissioning plan for the next financial year and beyond. Great. Forgive me for jumping around with the questions a little bit, but it's okay. Going back to things that have happened in the immediate past, I understand there have been some interesting key appointments made at the CCG. Well, me, if I'm interested in key. Yes, I was appointed on the 13th of August, I think. Okay. After a obviously open competition, which was very nerve-wracking. Myself, I had to go through a national assessment process before that, as did our chair, Dr. Richards. We're actually currently in the process of appointing other substantive members of staff at the moment, right? Through a process that NHS Merseyside are supporting us in. We have an interim chief nurse, who's Jan Snodden, who's absolutely fantastic, wealth of experience in nursing. Right. What will her responsibilities be? I was just going to say, that's okay. Her responsibilities will be oversight of the governance arrangements, so actually what will keep us safe, what will keep me out of court, right? What will keep patients safe and ensure quality for patients. She will take responsibility for safeguarding and leading on supporting continuing healthcare arrangements alongside our local authority colleagues. We've appointed substantively appointed a chief finance officer, who's Paul Brickwood, Paul is shared with Knowsley and St Helens CCGs.
Okay.
And we're going to have a shared finance team, because much of the stuff you do around finance you do once.
Yeah.
At creating ledgers and so on. But clearly there's a firewall between each of our accounts, monies.
Well, we're always encouraging voluntary sector groups as well to share back office services wherever they can. So I think that makes perfect sense in this environment. So going forward, tell us a little bit about the short-term goals for Holton Clinical Commissioning.
Well, the short-term goals are to continue with the commissioning agenda we've got. So that is around looking at pathway reform when we can. So we've worked with 5 boroughs in the last few months about introducing a new acute care pathway for people with mental health needs. We want to consolidate that. DVT, deep vein thrombosis, we're looking at the pathways for that to ensure that people with suspected DVT get more rapid access to the service and appropriate access to the service. There's obviously the short-term goal of maintaining performance within the current system. At the moment we do not have significant issues with delayed discharges. We'd want that to happen, want that to continue. We don't have significant issues around 18 weeks referral to treatment times. Again, we'd want to keep that in order. So it's about shaping the future system in terms of pathway redesign, and it's also about maintaining current performance and keeping a grip on the present. Short term also, we want to, by April, have consolidated our integrated commissioning arrangements with the local authority. Whilst it remains health and social care, the "and" in the middle is an increasingly small "and". We're becoming an increasingly integrated workforce. We're pooling budgets around continuing health care and other complex care funding arrangements. So the other, I think the fourth area is obviously to achieve authorisation. And clearly I think it would be lovely to achieve authorisation without conditions, but I do think there will be a development plan. I think it will be stuff we know about. But that will hopefully now be resolved by the end of January rather than December. The national nationally they've put the authorisation timetable back 1 month.
Final question for today, because we've in such a busy week, as you mentioned the authorisation there, we've taken up far too much of your time already.
No, it's fine.
And possibly a hard question given that the CCG's only existed for, I think it was 10 months you mentioned, but what would you like the legacy of Holton CCG to be?
The vision we've established, and the vision has been established after consultation with the public back in February. The vision is to involve everybody in the health and well-being of Holton. So I would actually want us to leave a legacy of improved health and well-being, improved quality of life, and people actually feeling they're engaged not only in their health and well-being but in the health and well-being of their local community. I think if you can't do that in a place like Holton, which has a vibrant voluntary sector, very, very committed borough council, both in terms of the officers and the elected members, and a fairly discrete, tight population of practices, 17 practices, then that's not going to be achieved anywhere else. And I'd want us to leave that as the legacy.
Brilliant. Thank you so much for your time today.
Thank you.